What's happening is that there is a shift happening, and it really has to do with the birthing culture. And it's a wonderful, wonderful thing. Women are beginning to question how they birth and reclaim their birthright, which is to birth under any condition they want, whether it be at home, in a birth center, in the water, or in a hospital. And with all this information, and the media does a wonderful job of, putting out documentaries and books, and there's tons of information online related to birthing naturally. And with this, women are excited about it, but it's also a little bit overwhelming when you don't know how to move through labor in a natural and non-suffering way. And today I'm going to be discussing the difference between pain versus suffering, specifically in labor. So pain is, it's a normal side effect of labor. It's telling you that your body is about to go through something pretty miraculous and pretty strenuous. And, we exert pain in many other areas as human beings. Athletes undergo lots of pain, especially, the professional ones. We don't really question the pain associated with exerting our bodies. We don't question that pain. We accept it as a side effect of something that we did. Well, labor is the same exact way. And when a woman doesn't have the care providers around her who understand that, and they're like pushing, well, here, take this, and this will take the pain away. You sure you don't want to take this? This will take that pain away. This will take that uncomfortable feeling away. And sure, the drugs will take the pain of contractions away, but they also take away the joy of birthing. And they also interfere with the hormones that your body naturally will produce to alleviate some of the sensations. So we're at this crossroads. There is this shift happening, and it's a wonderful shift, and I'm loving it, and I'm getting the emails from women who are questioning me about their up-and-coming birth, saying, I don't want to do it this way. I want to do it my way. How do I do it? And that's where I come in, and it's my quest, and it's something that I'm so passionate about providing sound comfort measures and techniques that have been around for a long, long time, but bringing them back into this culture here in North America, where women are questioning and wanting to take their labor back into their own hands. So let me make the differentiation between pain versus suffering, specifically in labor. Pain it's a physical sensation. It is usually associated with not feeling well. Sometimes people associate pain with being damaged or broken. Suffering, on the other hand, is a feeling of being overwhelmed, a feeling of being helpless, out of control. You don't necessarily need to be in pain to be in suffering. In labor, what that means is that when a birthing woman is going through her onset of labor, she's feeling the pains associated with labor, and she doesn't have this strong support team around her, a doula that believes that she can do this, a care provider who is, whispering in her ear, it's okay, we're going to get through this. You can do this. Those hormones that are coming, they're going to get you through this next sensation. If she has this team of people who are trying to feed her drugs because they don't believe in her body's natural capabilities to birth her baby, she goes into that hole of suffering. Women are suffering because they don't know what to do for themselves. They're literally handing over their power as soon as they become pregnant. Forget childbirth. When they become pregnant, they're not educating themselves, and they're not getting a doula. They're not reading these books on comfort measures. They're not doing their own research, and now they've fallen victim to suffering. It really begins with the comfort measures, and it begins with your team. Ultimately, your birth is in your hands, and I'm so passionate about this topic because, everything begins in birth. Literally and figuratively speaking, everything begins in birth, not for the baby, but for the mother. When a mother knows that she can birth her baby under her own conditions and how she wants to, and she knows and feels inside that she's had the confidence and the strength to birth her baby naturally, then it makes for a more confident motherhood. It makes for a more confident nursing mother, and it makes for a closer bond between baby and mother. Now, I don't ever want any women to suffer during labor, and that is why these interventions are here. Modern medicine is such a wonderful thing because, it is set up for the emergencies. It is there in case of an emergency, not just because you're in pain. If you're in suffering, and if you have a life or death situation, you can count on knowing that in 2013, it's going to be taken care of. You're going to have interventions set up for you to make it through. And 100 years ago, that wasn't the case. So we have to thank the doctors and thank the hospital culture for being there, once again, in case of an emergency, in case we need that emergency surgery. But if we look across the board, it's a small percentage of women that really, truly need these interventions.